Okay, I think we are ready. Thumbs up, Susan, and I'll get started. Very good. So I'm Sherry Holtzbacher with the Homeless Leadership Alliance of Pinellas. We are the collaborative applicant for the COC, the Pinellas Continuum of Care, the COC. And today I welcome you to our FY2026 HUD COC program, NOFO, applicant conference, where we're going to go over our local competition, the HUD terms, and what this looks like, all the materials, where you can find information, how you can forward questions, and any requirements that are going to help out in your application that you end up submitting for review. I wanted to share that there are most of us know that HUD has changed priorities significantly. We have worked on that now been talking about it now for several months. And so hopefully, if you didn't know, you'll learn more about it today. But for all of you veterans out there, veterans in this field here, you will notice some significant changes. And so if you're new, welcome. We definitely are encouraging new applicants because of those new priorities, as well as renewals. And we'll talk more about that moving forward. But just encourage you to really pay attention. Don't rely on any old NOFO that you may have processed, that you may have participated in the past. And definitely do encourage questions. If you have questions, we have a chat function. And so please enter them into the chat. There are other opportunities to present questions after the applicant conference. But use the chat for now. We have staff who will be monitoring that, and at certain points, we'll break in when it's a good breaking point to go over those. At the very end, we'll also have a full Q&A section. And the only other thing I have to say is the competition materials are posted on the funding page of the COC website and HLA's website. It is also linked there. More will be coming in during this applicant conference, where you will know where to find all that information. Make sure to look at it frequently. Refresh your page if you are like me and you keep tabs open, because it will not show you a new thing unless it's refreshed. And other than that, I'd like to just hand it over to to Susan Porchot, who's worked with us for a few years now on on the NOFO processes, multiple competitions, and knows she's been in Pinellas. She's not here now, but she has been very helpful in assisting us through the process in the past, and this one as well. So Susan's going to take it away, and thank you.
Thank you so much, and welcome everyone. This is talking about funding is always my most exciting time on PowerPoint, so I'm happy to be here to join you. Next slide, please. So as Sherry mentioned, I am a consultant to HLA and via them to the Continuum of Care at large. Next slide. And today I'm going to give a brief overview of the HUD COC program, especially geared toward those of you who might be newer to the process and kind of wondering, what is this all about? Then we'll talk about possible funding amounts that you might have access to in your continuum of care, the local competition process, some eligibility and allowability requirements, how to submit your project application, and then some additional resources. So let's dive right in. First, the overview of the HUD COC program. Next slide. So generally, when we talk about COC, we mean continuum. I'm going to turn off my video because I wave my hands a lot, and that's distracting, at least to me. The continuum of care, kind of generally speaking, is the local group that's working to end homelessness in a geographic area. But today, when we talk about COC, we're talking about specifically about the COC program funding. So it's a specific funding stream that comes into the continuum of care. It's not everything that's managed by the collaborative applicant, HLA, or by any of you, but a specific funding stream. It's administered by HUD, and every year and recently, a couple times a year, HUD has issued a NOFO, Notice of Funding Opportunity, that says what you can apply for, what kind of projects, and so on. And then the local competition is organized by the CoC's collaborative applicant, in your case, HLA. That process involves a review and rank committee that actually scores the project applications and ranks them to decide which projects will move forward to HUD. So HLA doesn't decide that. An objective review board does that. And then ultimately, those things get sent up to HUD, and HUD decides what projects will be funded. All right, next slide. So this is a scary looking slide, but when you get the slides, these will be clickable links, and I really encourage you to use them. One of the, frankly, kind of bigger mistakes I made when I was working directly in the field for organizations providing services and housing is I didn't use the regulations enough. So these are administrative rules that are set forth in stone that tell you what things are, definitions of homelessness, what does leasing mean, what are supportive services, and so on. And you can click on each one of those to find out more information. So if you're building your budget, and we'll talk about that in a minute, if you're building your budget and you're wondering, like, what is operating costs and what can I ask for in that category, you'll click on that link that says operating costs, and it'll take you to the rules about that. All right, next slide. Here are some, again, clickable links when you get the PowerPoint slides, which will be posted on the CoC website. There's a toolkit that HUD offers on their kind of training site, which is called HUD Exchange. And that gives you the basic requirements as well as the CoC program requirements landing page. You can sign up to receive emails about the CoC program or specifically about the CoC funding competition. Next. All right, now let's dive into kind of what's going to happen locally. First, let's look at the funding available. Usually at this point in the process, HUD will have issued a report that says, here's how much money you can ask for. They haven't published that report yet, so we made a stab at just guessing what those numbers will be based on past experience and what's in the NOFO. But there are question marks here, and there's kind of reddish type ink on the slide to serve as a disclaimer that you can't really rely on these numbers. They're just kind of parameters, general guidelines to help you kind of get started. So the first number is called the annual renewal demand, and that is the number that if all current existing CoC projects that are getting funding now were renewed by HUD, then that would total up to 6.429 million. That doesn't mean they will be. It's possible that not all renewals will kind of make it through the local competition process, or even if they did, be selected by HUD for funding. But if they did, that's what that number is. The CoC bonus project is specifically set aside for new projects, 1.165 million-ish. And that's for new projects that are not specifically oriented toward households fleeing or attempting to flee domestic violence. There's a separate set aside for DV bonus projects, new projects serving the DV population, and that's about 1.55 million. And then there's a planning, the CoC planning project amount that's available just to HLA to help kind of run the continuum of care. So the total you have available is $9.5 million-ish. So that's a good chunk of change. I don't care who you are. And so be thinking about kind of within those parameters what you might want to ask for. If you ask for $10 million, it's unlikely your project will be go forward at that amount. Another important number, and this I know will mean a lot to those of you who have competed in the past, is the Tier 1 amount. In every NOFO, HUD says kind of which projects, if ranked the highest, will have the highest likelihood of succeeding. That's a number. It's not a specific number of projects, but a dollar value. So as we'll discuss in a minute, when projects are scored and ranked locally, they are then submitted to HUD with a ranking from, say, 1 to 20, if there's 20 applications, where 1 is like the most important and the highest ranked by the CoC review committee and executive committee, and then 20 is the lowest ranked. So if you add up the numbers of the top group, once you get to 3.857-ish million-ish, then those will be in Tier 1, and everything else falls into Tier 2. So although there are no guarantees, the projects ranked in Tier 1 are somewhat less competitively scored than the Tier 2. So they're safer, if you will. They're not safe, but safer compared to Tier 2. We'll talk a little bit more about that in a few minutes. So let's move ahead and talk about kind of what it looks like locally. There's the collaborative applicant has already issued the request for applications. You are participating in this workshop. And then you will submit your project applications, including a budget if it's a new project, via email to this specific CoC NOFO at hlapinellas.org email using the forms provided on the website by the deadline that's on the timeline. And then your project applications will be reviewed, scored using a very specific objective scoring tool, and ranked by the CoC Review and Rank Committee, which the CoC Executive Committee then approves that or revises that ranking. And then if you were selected to be included, then you're going to have to go through a whole nother project application process in eSNAPS, which is the online grant system that the HUD CoC program uses nationally. So first you're going to use these kind of, they're not really paper, but essentially paper applications. And then if you're selected, then you go online into eSNAPS and you put in your information in HUD's very specific project application forms. That's a whole nother thing, which we'll come back to in a minute. So let's look at the timeline. This is too much to go over, but your key things to note are that project applications are due July 16th, July 16th at 4 p.m. to that specific email address. If it's a renewal project, then you'll submit a renewal project application for each project. If it's a new project, then you'll submit a new project application plus a new project budget. Then there'll be a threshold review by HLA. There's the review and rank process. And then if you are selected, then you'll have to have your project application in that online grant system, eSNAPS, by August 12th. So that's another key date for you to note. All right, let's move on to take a look at some kind of specifics around what this funding will fund. So let's first look at project applicants. These are the groups of project applicants that are eligible. If you're a nonprofit organization, there's specific rules about what kind of your status and your filing. You need a unique entity identifier, UEI, and a SAM.gov registration. And we'll talk about capacity thresholds in a minute. But let's first look at the next slide, which is about kind of projects, the program requirements overall, kind of overarching program requirements. First of all, your project must serve people who are homeless according to HUD's definitions in categories 1, 2, or 4. And that may not mean anything to you. So click on this homeless definition chart link. And there's a very helpful chart that HUD developed several years back that says, what is category 2 homeless? What is category 4? And so on. In most project types, there are additional restrictions on those who you serve. For instance, in street outreach projects, you're serving people who are staying in unsheltered locations. Typically, these definitions will not allow for funding for homelessness prevention projects or projects serving people who are doubled up or couch surfing, youth who are in foster care. There's kind of groups of people who are probably have what you might call housing instability, but aren't homeless. So pay attention to that homeless definition chart. Next slide. And this is the threshold capacity requirement I mentioned earlier. If you're, you have to have a governance system, for instance, a board of directors, some staffing, some financial systems like an accounting system with internal controls, checks and balances. You need to have sufficient cash flow that will enable you to spend money before you're reimbursed for it by HUD, because this is a cost reimbursement grant. And if you're, say, a brand new nonprofit, I'll give an example of someone that might not have administrative capacity. A brand new nonprofit where there's 3 people on your board, and they're your dad, your sister-in-law, and your husband. All volunteer run, no staff, just using a spreadsheet or an online banking system to keep track of money. And then one person does all the deposits and writes all the checks and approves everything. And then you don't have much funding yet. So it would be hard for you to spend money before you get reimbursed. So that's not an organization that would have capacity. You must also agree to participate in HMIS unless you are a DV-specific project, and then you must at least participate in the comparable database. You must also agree to participate in coordinated entry, which includes accepting CE referrals into your project. That means you can't kind of pick and choose the people you want to serve versus the COC-wide coordinated entry system prioritizes people and kind of sorts households, if you will, based on the appropriate project that they might be served by. If you have questions about that, just look on the COC website. You must also be able to provide a 25% match. It can be cash or in kind. In kind is things like volunteer hours in the project, donated furniture and supplies, and so on. And then there are a bunch of other requirements that I'm not going to belabor. So just click on that link to see what the others are. All right, let's move on. Now we get into the real nitty gritty. What can you ask for? You have to pick a project type for your project. You can't just say generally, here's a project that serves people experiencing homelessness. No, you have to pick one. And here's a list of the ones you can pick from: street outreach, standalone services, transitional housing, rapid housing, and so on. So for non-DV specific projects, those are projects serving kind of general population, households experiencing homelessness, could be families or adult-only households. There's a group at the top. For DV specific projects, you can only pick from 3: transitional, rapid, or coordinated entry, specific to DV households. If you have current funded projects, then you can apply for whatever your currently funded project is. All right, let's move on. So there's a group of slides here that talk about what each of those things are. And I'm not going to go into details. These slides are more for your reference later if you're trying to figure out what kind of project you've got. But basically, supportive services only provide supportive services to people who are unsheltered if it's a street outreach project, or if it's an SSO standalone, it can be also for people who are in emergency shelter or unsheltered. All right, next. Transitional housing is temporary housing that can last up to 24 months, but is often shorter. That includes a place to live temporarily. It could be a scattered site using apartments, or it could be a transitional housing facility. Then the next one is rapid rehousing, which is a permanent housing project where you would provide leasing or renting of a rental unit for up to 24 months to help the household stabilize. And then the next one is permanent supportive housing. It's also permanent housing. That is, there's a lease. But where rapid rehousing, that lease for that rental unit is between the household and the landlord. It could be for permanent supportive housing, a kind of similar situation, but the permanent housing is not time limited, whereas rapid rehousing was limited to 24 months. And also households in PSH have to have a disability. I will also say you can also use a master leasing project. Master leasing is where the lease is between the household, between the organization, your organization, and the landlord. So let's talk about allowable costs. Not all of these costs are allowable for every type of project. So you have to kind of be careful which ones you ask for in your budget. I'll come back to that in a few minutes. But let's go to the next slide and talk about rental assistance first. So this is the situation where the lease is between the household and the landlord. Minimum habitability and lease requirements. I won't go into those details here. Let's look at the next one, which is leasing. When you use leasing funds in your budget, the lease has to be between the landlord and the agency, not the household. But then the organization would have a kind of occupancy agreement with the household. So for both of those two, rental assistance and leasing, you usually have those in rapid rehousing and permanent supportive housing projects. Operating costs are operating costs that pay day-to-day costs of a HUD COC funded project. For those of you who are newer to this funding, make sure that if you ask for operating costs, it's not to support your overall organization. It has to be for this specific project. So say you have a transitional housing facility, a site-based facility, you can ask for help with repairs and maintenance, property taxes, insurance, and so on. There's a section on the slide that says some restrictions that you need to be careful not to violate. But let's move on to the next one in the interest of time. Admin. So if you're asking for $100,000 for your project funding, you can ask for up to 10% for admin. It has to be admin, again, associated with the project you're talking about with HUD, not for your overall organization admin. So it might be a piece of your executive director's salary that kind of reflects how much time they spend on this particular project. And also the same with, say, the CFO, how much time that person spends related to this particular project, and training for staff. So for each of those slides at the bottom, there was a little link to where you can learn more. Thank you. So now let's look at how to submit your project application. Next. The competition materials are on this PinellesCoC.org funding landing page, and there's a screenshot of it here. You'll see the request for applications. You'll see the project applications, the budget form for new projects, and you'll see the scoring tools. Next. So first you'll decide if you're an eligible project applicant and have the capacity to administer the funding as we discussed. Then you'll determine what specific eligible project type you want to request. You can submit multiple project applications, one for each project type. So if you want to do a street outreach project and a transitional housing project, those are two separate project types and therefore two separate applications. You'll choose the correct project application from that landing page and a budget form if it's a new project. And then you'll submit all of that stuff to that special CoC NOFO email address by the deadline. If you're selected through the review and rank process to be included as the process moves forward to HUD, then you'll put your project application into eSNAPs. Here's a really important note for those of you who are not eSNAPs users. It's not easy to use. It's very user unfriendly. So immediately, if you're not an eSNAPs user, even before you find out whether your project's going to move forward, go ahead and get the process started. Sign up as an eSNAPs user. Get permission from HUD to use the system. Set up passwords. Add your staff, and so on. Put in your organization information, upload your 501c documentation and your code of conduct. Do all those preliminary steps so that once you find out that your project, if your project is selected, you're off and running, putting that data into the eSNAP system. I'll give you some tools in a minute that will help with that. All right, let's look at the a few kind of warnings. First warning is that HUD has set out very specific threshold criteria for new projects in particular. And so when you're putting in a new project application using the project applications that are on the CoC's landing page, you'll see in the project application certain questions that are italicized. Those reflect threshold questions. If you don't meet that threshold that HUD expects, your project will be rejected out of hand, and it won't even be evaluated any further. As an example, transitional housing projects have to have a plan in place to ensure that at least 50% exit to a positive destination and 50% exit with employment income. If you say your numbers are 40%, you've failed that threshold and your project is rejected. So pay attention to those italicized items. And if you have questions about what any of those mean, we'll give you an email address in a minute that you can email questions to. So threshold or criteria are important. Here's some common errors to avoid. Do not submit more than one project per application. So you want to do a transitional housing project and street outreach. Those are two separate applications and two separate project types. So on the very first page of the project application, you'll see a place where you check the project type. There should be only one box checked. You have to pick one. And if you pick a different one, that's a new project application. Don't complete sections of the application that don't apply to your projects. So when you open the project application, you'll see a bunch of different sections. Everybody completes the first page on the project application. I'm talking about the new project application here. And then you will complete in the next section, you will complete the part that is for your project type. So there's a section for transitional housing. You'll answer those, say, 10 questions. You won't answer any of the rest of the sections in that first part or that second part because those apply to rapid rehousing, street outreach, and so on. Then there's a section that I believe it's called project description. And everybody answers the part that says at the top, all projects. So you do that section. And then you move on to that last kind of section of the application that again is specific to your project type. And you'll complete those questions, you'll answer those questions for your specific project type. If you put information in the sections that don't apply to your project, it's going to be ignored. So you've kind of wasted your time and confused everyone. So don't confuse anyone. Finally, a word about the budget. The budget is an important part of you telling your story. And I say this not just because I used to be an accountant, but it's a thing that the Review and Rank Committee will look at pretty closely. If you say your project is going to serve 15 households, don't budget for 2 case managers. That's too many case managers. So make sure that your narrative and the way you answer the questions in the application, it's proper, matches what's in your budget. If you say that you're going to have a transitional housing facility, but you budget for rental assistance, that doesn't make sense because you can't ask for rental assistance for a transitional housing facility. So you have to submit in your budget the costs that are allowable for your specific project type and design. Another note, kind of in general, is checking for inconsistent information. This is within your project application and between your application and your budget. If you say you're going to, on the project application, you're going to ask for $500,000, but you submit a budget for $300,000, again, you're just confusing people. Also, if in one place in your application you say you're going to serve 40 households, but in your narrative you say 60, that is just, there's a lack of clarity there about what you're actually doing. So you might want to hand it off to a colleague and have them check for internal inconsistencies. All right, let's look at the next slide. I think those are all my common errors, yes. Okay, so here's a note that only applies to renewing projects. So if you don't have current COC funding, you can zone out for a second. For those of you who have renewals, you can transition that project to a new project type using the transition grant process that HUD allows. If you have, for instance, a rapid rehousing project that you want to turn into a transitional housing project, you can use the transition grant process to do that. That gives you a year to make that change from rapid rehousing to transitional housing. So it's not an abrupt, sorry, everybody in rapid rehousing is out as of June 30th or whatever. You have some time to phase out the old project and phase in the new. In that case, you'll submit a renewal project application that says, we want to reallocate this funding, but direct it to this new project type. And then you'll submit a new project application and a budget for your new project type that you want to replace the old one with. If you have questions about that, reach out to the email address. All right, some resources for you are next. Here's the link to the funding page, the funding landing page in your COC, a link to the NOFO, HUD NOFO itself. HUD has a competition landing page that currently doesn't have much information on it, sadly, but they have promised that they're going to upload additional information there. So for instance, one of the things that you'll find there are detailed instructions on how to put your project into eSnaps. That's not there yet, but you're going to, once it's there, you're going to want to follow those detailed instructions to the T in order to get things in eSnaps correctly. Then there's a link on the slide to toolkits and other resources about eSnaps. If you're new to the system, you'll want to use those. And then finally, there's a link to the actual online grant application system. All right, here's the important contact emails. Any questions you have, your project applications and other information related to this competition locally need to be sent to that email address. So as tempting as it is to reach out to your friendly COC person directly, it's better to reach out to the COC NOFO address because multiple people will be monitoring it and you'll be more likely to get a quick answer to your question. Any questions that are submitted before the kind of cone of silence date that's on the timeline, all of those questions and the answers will be accumulated by HLA staff and then posted to the competition landing page. So you can go back and look and see what questions other people asked and what the answers were. That might help you too if somebody else thought to ask a question that it informs your project. Then there's also an email address where you can reach out to HUD directly if you have questions about the NOFO. I will say that there is quite the delay in getting responses from that email address. I've been waiting 2.5 weeks on some of my answers, so I were you, I would also ask HLA whatever that question is and see if you can get it answered locally more quickly. In some cases, um, the information that the COC has is not sufficient to answer your question. In that case, you need to ask HUD. And then finally, there's an eSNAPS address at HUD where you can reach out with your eSNAPS questions, and they have been very responsive. So if you, for instance, are an eSNAPS user, but you need a password reset, they're very quick to respond to that type of question. All right, we've got a good 15 minutes or so left for questions. I'll turn it back over and see what questions we have.
Yes, we have nothing in the chat so
What?
far, so I know. I've been watching. So, okay, now we have them. Jaleesa Jones asked, can two renewal projects be consolidated into a single project?
Yes, they can.
As a
If
new
it's a
project, though, right?
um, if you can consolidate two renewal projects of the same project type into one project in eSNAPS. That's not necessarily a thing you would need to do in the local competition process. In the local competition, you would just submit two renewal project forms saying you want to renew both projects, but then consolidate them through the eSNAPS process. If you have two project types that are different, say safe haven and permanent supportive housing, you can't consolidate those. So they have to be the same project type. But consolidating renewals is still a thing. If you want to transition to a new project type, then you can't consolidate and you can't change your grant year from the old project year or the amount.
Will the application in eSNAPS have different questions than the first application that is submitted?
Almost certainly.
Yeah, almost yes. We don't know what those questions are just yet is one of the issues. In a perfect ideal world, we would just issue the application that is in eSNAP. So it'd be a one and done, and anyone who's learning eSNAPs or having any issues, by the time that your application was due, you'd know that it was accurate and correct in the system already.
Yeah, we can't do that really because the project application form is not in eSNAPs.
Right.
So we don't know what those questions are going to be, but we made an educated guess on what the questions will look like. That's what you see in the project application. So you'll be able to use a lot of that same information, but it won't look the same.
And a question from Lindsay is, what housing gaps is HLA most interested in filling this year? And I'll be more specific, the COC is interested in filling this year. And HUD. So just being realistic, HUD is looking for more diversity of project types. And so that's why transitional housing, supportive services only, standalone, and street outreach are new. They have not been covered under this type of funding for quite some time. And so there is the way that the NOFO, if you read the original NOFO from HUD, you'll see that there are set asides, and the way that it works out is that there is, especially for new projects, for there to be more transitional housing, more supportive services only, and service requirements, so service participation requirements. HUD is interested in um, again, Susan shared some of what that covers, and it's in regulations and everything, but what falls under that. But that would include substance use treatment, mental health treatment, and case management and workforce development, and a plethora of options and activities involved there. And so we are looking for, because that tier one that Susan was mentioning earlier is at 60%, and in the past it's been higher. Uh, for renewal projects, it's going to be very selective on which renewals would be able to fit into the amount of funding that is available to us for that tier. And so, and new projects can be considered for that tier as well, of course. That is up to the Review and Ranking Committee and the COC. But definitely looking for a good mix of projects during this cycle.
I will also add that if you get into the weeds of the HUD NOFO, there's a section called HUD selection process, where they kind of lay out how they're going to decide which projects get funded. And that's pretty helpful reading. And if you have a question about how to find that, just email us. But basically, it says what Sherry just summarized in more user-friendly terms, but HUD is definitely looking for supportive services only in transitional housing projects. So they will fund those if they show up in tier 2 before they will fund, say, permanent housing projects.
Mm-hmm.
So I think if you're kind of looking to see what HUD is looking for, that's a useful part of the NOFO.
That is a good section to look at for sure. Uh, and if a grant is rejected, so Candace, I believe you asked, if a grant is rejected with everything properly submitted, will the agency receive some form of a debriefing of the reasoning behind that decision? If it doesn't meet threshold, we're going to let you know why. You'll get that information. If during the review and rank process, that is a public process. So it's open for candidates to come in, applicants to come in and follow along. And so you'll kind of figure there, sometimes an application may not be included in the final rankings just because there was no more funding left. So it could have been a perfectly fine project, but then it just didn't meet that threshold, the bottom or the high ceiling that HUD has. And so that could be a reason. So just to keep that in mind, but throughout we don't necessarily do a full overview of this is everything about your application that you needed to improve on because there are so many different factors involved. There's local needs, there are scores, of course, and just the funding amount available, and so it wouldn't really be possible to do that. But coming to that review and rank process that would give you a good idea of what's going on and why decisions are being made. Can you talk more about what is considered supportive service?
Yeah, I can do that. Would it be possible to move the PowerPoint back to that slide that was on allowable costs, the supportive services section?
There we go.
So here's a kind of a laundry list of things. And almost all of your projects will likely have supportive services. Case management or a similar advocate, whatever you call that position, is what many projects include in terms of the budget. But you can pay for any of these other things too. I do recommend that for each, if you're, say, looking to build something into your project for legal services, click on that link and see what kinds of legal services HUD will pay for from this program. It's not everything. So for each of these, there's specific types of things for each category that HUD will pay for, but not other things. So I would dig into each of these line items by clicking on that link that's at the bottom and look at how they describe, for instance, housing search. What does that pay for? We'll have to go to the regulations to see exactly what's in that. But this slide does give you an overview of the breadth of what supportive services can include. Behavioral health services and employment assistance are things that this HUD administration particularly want to see. You don't have to do that through your budget. You can say you're going to, use Career Source and your local behavioral health entities to do those things, but you can pay for some things. If you have a household that is looking to enroll in a CNA class, then look at the employment assistance definition in the regulations to see if that's an allowable, if paying their fees is an allowable way of assisting. So there's a lot more to each of these line items, but you can see that it covers a lot of stuff. Another thing to note, I'll just say as an aside, is that your match has to be for things that, if it were in your budget, would be allowable for this project. So let me think of a thing that's not allowable. Inpatient health services is not allowable under this grant. So inpatient health services can't be part of your match because it couldn't be on the budget if you paid for it. Therefore, it's not an allowable match. So those are also things that you need to think about in terms of what is your match, what do you want to pay for out of this grant, and what are you going to accomplish by partnering with, collaborating with others. I'll also, last thing on this, because every question leads to a million connections. HUD has expressed in this NOFO a preference for having on-site substance use services. So if that's going to cost you money, I would build it into your budget. In the past, many providers have referred out for that, but it might be worth thinking about how you can accomplish that on site and if it would lead to additional costs in your budget, and if so, budget for it or provide it as a match. Okay, back to the questions.
If street outreach is eligible and transitional housing is eligible, this is a good, Susan, follow along on this. This is good. But emergency shelter is not. Is the assumption that HUD is anticipating people will move from street outreach into transitional housing rather than to emergency shelter? I have a short answer for that, but
Go ahead.
my short answer, I can't assume anything with HUD. That would be my short answer. And I don't know if that really is their intent. I know that it would be more services available in transitional, but how would you answer that, Susan?
I think because HUD has expressed in their NOFO and other places that reducing encampments and unsheltered homelessness is a priority, that they would also like to see people moved into emergency shelter. The only reason, in my opinion, this is an opinion only, that they're not funding emergency shelter out of this is because it's not in the statute and the administrative rules that that's an allowable thing that they can fund out of this, because there's a whole nother program that HUD operates called the Emergency Solutions Grant Program, which is kind of a sister program to the CoC program, and that funds emergency shelter. So I think it's not because HUD doesn't like emergency shelters. I think it's they want people moved from encampments into anything. um, whether it's institutions, transitional housing, shelter, or permanent housing. Um, I will say that for supportive services only um, standalone services, project applications, you can ask for supportive services for people who are in shelter. So that's a thing to think about. Um, it's the language is not entirely clear. So, like Sherry said, we're only guessing a little bit at what HUD intends, but that does seem to be a thing that you can do.
Yeah. HUD has expressed rebalancing the portfolio and has brought in emergency shelter into that portfolio. But again, like Susan said, ESG does cover emergency shelter, and so this is one attempt to, I think, to bolster transitional housing and supportive services. But and definitely, thank you, Susan. Reducing unsheltered homelessness is the primary goal there. Okay. Shiloh shared some information. Guidance for eligible costs under each supportive service category was shared in the chat. Kevin asks if we wanted to combine two same project types, like permanent supportive housing, PSH, as part of our renewal process, but reduce the total dollars needed to put more money into reallocation. Can we do that?
Yeah, on your renewal project application form, there's a place where you say kind of what your current grant is and then what you want to ask for this time. And that can be less. It can't be more, but it can be less. So if you have a $500,000 project now, PSH, but you are only going to ask for 400,000, then just indicate you want to have $100,000 available for voluntarily reallocated.
Libby asks if we designate new transitional housing for veterans, do we need to take those referrals from the VA or would those still come from the COC?
It's a local decision, so I'll defer to you.
That is, I will probably have to get back on that one. Do I have somebody from HMIS if you are not able to answer this question, it's okay. But if someone can answer that, because that is a very specific one that I've not run into yet. I only know about
We, we
comparable.
would we would have to look into that a little further, Sherry.
Okay, let's note that so that we can come back and we'll put that in the question and make sure that Libby or everyone who was on this call at least gets that and it'll be included in the Q&A response later posted. Thank you. Libby also asked for transitional housing projects, are there exceptions for employment income for seniors and those with disability?
Yes, there are. I think someone else um, was kind enough to answer that in the
Over the
chat.
years.
So yeah,
Okay.
I'm going to, if I can get to it, I'm going to put in the chat the link to that information about what supportive services is, so you can click on it from the chat. Somebody asked about that, so you see if I can accomplish that without turning off my Zoom. Okay, I just put in the chat the link to find the information about what supportive services are allowable. for Shiloh.
Okay, are there any other questions?
I will say on that question about um, participants over 62 and those with disabilities slash handicaps, HUD talks about it different ways. If you need more information on those exceptions, just shoot us an email and we can send you that specific language.
Okay. I am seeing no more questions. Again, is there one-on-one advisement with this process? We do offer support, so we'll answer questions. They will be listed publicly or posted publicly, any responses that we give. So please do reach out. If you need help with eSnaps, we do provide that support too. And so those are definite avenues to take to use that COC NOFO at HLA Pinellas.org. And does one have to be a 501c3 to apply? You can't be a for-profit. That is for certain. But there are multiple categories of entities that can apply, including
For instance,
or
a church often has no, I think I'll look it up to confirm this, but if you're not designated as a nonprofit, a 501c3, a church, an educational institution, you're probably not eligible. But if you submit a question to that email address, we can look up your specific situation.
are there any changes to 24 CFR that impacts this NOFO?
No.
No.
Although this current administration's HUD interprets things somewhat differently than prior administrations have. But 24 CFR 578 has not been amended.
Okay. Well, we are at time, so I thank you. I want to just thank you, Susan. Thank you, everyone else, for coming. We will have, as soon as possible, we're going to post this recording and the PDF of this presentation on the landing page for the funding page for the COC. I just want to remind everyone, please review there's some in the request for applications points you to a couple sections of the NOFO. If you don't have a chance to read the whole thing, I recommend reading the whole thing. It's fun, but definitely focus on some of those sections that we point you to when you're developing your applications and moving forward. And eSnaps, get on it. Make sure that your passwords are working, that everybody who needs access to it has access. And definitely once projects are selected to move forward, then start inputting that information into and it's available and when it's available by HUD, of course, on eSnaps, start inputting that information, those applications right away. It's not something really to wait on. Usually we do end up providing quite a bit of assistance to everyone when it comes time for that. So any preparation that can be done in advance would be fantastic.
Could I double check to see? I'm not sure everybody has put in their organization, and I know you had to register, but we want to make sure that we have a record of who attended. So if you didn't have a chance to do that, then go ahead and put that into the chat before we close.
Thank you.
All right. Thank
Okay.
you all.
Thank you.
Thanks, everyone. Have a great day.
You too.
You too. Thank you.